So this is the last part. So you all know arteries, capillaries and veins. Now never make the mistake about this, So arteries are blood vessels that are going to carry blood from the heart towards the organs, okay, to supply the nutrients and the oxygen. Veins are blood vessels that are going to bring back blood to the heart. Okay, even the other day during the lab exam, I heard a student saying it was a vein and then this is coming out of the liver. Veins don't come out of an organ. Veins are actually, it is transporting blood back to the heart. So it is going back to the heart. It's traveling through the liver and then back to the heart. Okay, so they carry the deoxygenated blood and the blood that has lots of waste products back to the heart. Okay, so never interchange the two words. You can't interchange them. An artery is always an artery that is going to carry blood from the heart towards the organs, and the veins are going to bring the blood back to the heart. And in general, arteries are colored red because of the oxygenated blood. Veins are colored blue on a photograph or on a model. Okay? In the actual sense, if you open up an artery or a vein, the blood is of course red in color. The only thing is deoxygenated blood is a deeper red. Okay, the red is a little bit more deeper, whereas arterial oxygenated blood is a bright red color. Capillaries are the blood vessels that are going to supply every individual cell in your body. Okay, the tiniest blood vessels. Now, so we have looked at pulmonary circulation and systemic circulation. You know about this. Let's look at the arteries and the veins. What are the characteristics of these arteries and veins? Okay. So when you look at an artery, you have the largest arteries in the body. That is the aorta and the pulmonary artery. These are the great vessels. These are the great vessels that emerge from the heart. These blood vessels are called elastic arteries. Elastic arteries. Okay. We'll come to this, okay. Elastic arteries, because these are large and they have a lot of elasticity, elastic fibers. So they are called elastic arteries. So when you look at an artery and you make a cross section and see the wall of the artery, an artery is made up of three basic layers. The outermost layer, this is like any organ, the outermost layer is connective tissue. This is connective tissue. And this is called the tunica externa. Tunica externa. Okay. So this is an artery. And this will be a vein. Let's say this is a vein. In the vein, the tunica externa is a little bit more thicker, more connective tissue than in an artery. So this is tunica externa of the vein. So the outermost layer. The middle layer is smooth muscle. The middle layer is smooth muscle. This middle layer is called tunica media. And this tunica media is smooth muscle. Okay. In the artery has thicker smooth muscle, lot of smooth muscle. So it's a very thick wall. In the vein, the smooth muscle wall is thinner. There is less smooth muscle. Okay, so in the vein, tunica media, thinner layer of smooth muscle. Thinner layer of smooth muscle in the veins. Okay. In addition to that, along with the smooth muscle in the artery, you will also see, I don't have proper colors, you will also see elastic fibers, which allows the artery to expand and recoil. So it's like a rubber band. So whenever blood is pumped into the artery will expand and then it will recoil back. It will come back to its original position because it has this elastic lamina. Okay, there are two layers of that. So you have an external elastic lamina and there's an internal elastic lamina. Veins also have elastic fibers, but not to that extent. Okay, they don't have too much of elastic fibers. So this is the elastic fibers. So there is a lot of it in the artery, and in the veins, less elastic fibers. Less elastic fibers. Okay, and then comes, yes?
Is the reason that the arteries have more smooth muscle than the veins because they have to step back into shape after, a big...
Yes, and they also have to handle the pressure with which the heart is pumping the blood. Okay, so that pressure is high. So you need to have a really good tube to handle the pressure without bursting.
That makes sense.
Okay,
Thank you.
yeah. And then the innermost lining, the inside lining. The innermost lining is just a single layer of flat cells. Okay, so this is the innermost lining. This is called the tunica interna. Tunica interna, that is the innermost layer in both the artery and in the vein. It is, what is this tunica interna? The tunica interna is simple squamous epithelium. Simple squamous epithelium. And because simple squamous epithelium is a broad term, it's a tissue, right? So in a blood vessel, you call this the endothelium. You call it the endothelium. So the inner lining of the blood vessel is endothelium. So when we did blood also, I told you, blood is in contact with this endothelium. That's the one that is in contact with. Okay, so that's the structure of an artery and a vein. Now the one big difference, I've told you the difference. In an artery, it has thicker smooth muscle. So the tunica media, the middle layer is thicker. In the veins, the tunica media is thinner. Arteries tend to have more elastic fibers than veins. Okay. And then the last difference is veins have valves. Veins have valves. Arteries do not have valves. No valves. No valves here. Veins have valves. And we will see why, okay, when we look at the veins, because especially the veins of your legs and your abdominal cavity, you want the blood to go back to the heart. You don't want the blood to stagnate, okay, especially when you're standing. You want the blood to go back to the heart. So that's the reason for the valves. So we'll talk about that, okay. So now, let's look at the arterial side first. Let's look at the arteries. So the first, these are the first blood vessels. These are the first ones. Okay, these are called elastic arteries. Elastic arteries, why are they called elastic arteries? Because they are capable of expanding and recoiling. So when the left ventricle pumps the blood into the aorta during ventricular systole, the blood vessel, the aorta expands. The same with the pulmonary trunk. When the right ventricle pumps it into the pulmonary trunk, it expands to receive the blood. And then when the ventricle begins to relax and the semilunar valve closes, it recoils back. Because of the elastic fibers, it is able to get back to its original position, creating the diastolic pressure. Okay, when we did blood pressure, we saw that. So these are called elastic arteries. So aorta and pulmonary artery and its major branches, like the carotid artery, the subclavian artery, all of those are elastic arteries. Okay? Now, then as these arteries go towards the organ, you see smaller and smaller branches. So we saw the celiac trunk branching into the gastric artery, splenic artery. Now, these arteries are called muscular arteries. These are called muscular arteries. So as you can see here in the first picture, so these are the major blood vessels. This is not a very complete picture, but this is the major blood vessel. And then as the blood vessel goes towards the organ, you saw all the branches of the aorta. You studied about that. So these are called muscular arteries. Okay. Now these muscular arteries, the only difference is the diameter is smaller. Okay, they are a little smaller than the bigger blood vessels, like the aorta is the largest. So these are a little smaller and there is less elastic fibers. Otherwise, they are pretty much the same. Pretty much the same. So the large elastic arteries have more elastic fibers, whereas this one will have a little less. Okay, but and the size also, see the lumen, the diameter is smaller. Okay. So muscular arteries is the second one. These are the branches of the aorta, branches of the major arteries. They are all called muscular arteries. Okay. Now third, as the arteries enter the organs, when they enter the organs, they become even more smaller in size. Okay. These are called arterioles. So arterioles are the blood vessels that carry the blood into the organ. So once they enter the organ, then you will have these arterioles. Okay. Now the most important feature of an arteriole is that it doesn't have any elastic fibers. The wall is only made up of smooth muscle. Okay. So tunica media has smooth muscle, but no elastic fibers. No elastic fibers. Okay. So tunica externa is connective tissue, tunica media is only smooth muscle, and then tunica intima, which is the endothelium. Now, what is the importance of this kind of a blood vessel, which has only smooth muscle? So, arteriole is the blood vessel that is capable of narrowing and dilating, okay, thereby adjusting the amount of blood entering the organ. So these blood vessels are very important because they are capable of adjusting the blood flow to an organ. So when more blood flow is needed, the arterioles will dilate. When less blood flow to the organ is needed, the arterioles will constrict. Okay? So that's the feature. Because of the smooth muscle, they are able to do that. Okay. So these blood vessels, number 3, capable of, we call it vasoconstriction, capable of vasoconstriction and vasodilation, thereby adjusting the amount of blood entering the organ. So depending on the organ's requirements. Okay. So that's what these arterioles can do, vasoconstriction and vasodilation. So let's say this is the normal arteriole diameter. This is the normal. This is the normal arteriole, the lumen, okay, the diameter of the inside. When the arteriole vasoconstricts, that is, the smooth muscle is going to contract, and so the inside lumen is going to become smaller. Okay? And on the opposite side, vasodilation, the smooth muscle is going to relax, and so the arteriole is going to become wider. Okay? Now tell me, when the arteriole constricts, is it going to become more difficult for blood to flow through the arteriole or easy for blood to flow through? More difficult because it's a narrow passage. Okay? So vasoconstriction will increase the resistance to blood flow. Resistance means the difficulty with which blood flows. It will increase the resistance to blood flow. And because of this, what will happen to the blood flowing into the organ? It will decrease the blood flow to the organ. Okay, it will decrease the blood flow to the organ. The opposite is going to happen when the arteriole dilates. When it dilates, it makes it easier for blood to flow because there is no narrowing, there is no obstruction. So vasodilatation or vasodilation decreases the resistance to blood flow and thereby, and because of that, it also increases the blood flow to the organ. So see the relationship between resistance and blood flow. If resistance increases, if it becomes more difficult for the blood flow to the organ decreases. If resistance to blood flow drops, that is, it becomes easier for blood flow to the organ increases. So this is the relationship between resistance and blood flow. Okay? And because of this, because the arterioles are capable of changing the blood flow to an organ, arterioles are referred to as resistance vessels. They are called resistance vessels. Very important when we are going to talk about the control of blood pressure. How does your body adjust your blood pressure? These arterioles are very important because they are capable of constricting and they are capable of dilating. Of course, the elastic arteries can also do that, but not to that extent. Because they have elastic fibers, they will recoil back to their original position. Okay, so the arterioles are the ones that are capable of adjusting this. So that's why they are called resistance vessels. And what is the single most important factor that can cause the arteriole to constrict or dilate? The single most important factor is sympathetic stimulation. sympathetic stimulation is the most important one. There are other factors like oxygen, nutrient availability, many things that can cause vasoconstriction or vasodilation. But the most important factor is sympathetic stimulation. Okay? Under normal circumstances, when everything is going fine, this is the diameter of the arteriole. If sympathetic activity increases, okay, if your sympathetic nervous system is sending lots of impulses to the arterioles, increased sympathetic activity will cause vasoconstriction. Okay? And decreased sympathetic activity will cause vasodilation. So there is no parasympathetic nerve innervating the blood vessels. So it is mostly sympathetic activity. So the balance in the sympathetic activity. So if your sympathetic activity goes up, if those nerves are firing, vasoconstriction will occur. Okay? If sympathetic activity drops, it will cause vasodilation. Okay? So you will understand this better when we get to the control of blood pressure. Okay? But for now, remember resistance vessels. Which are the blood vessels that are capable of constricting and dilating? It's the arterioles. We come to capillaries. So the last one here, after arterioles, once the blood vessel enters the organ, the last one is capillaries, the tiniest blood vessels. So from arterioles, the next one, number 4, okay, would be capillaries. Now these are the individual blood vessels that are going to supply every little cell in your body. Now if you look at the capillary, it only has, there is nothing like a tunica media, tunica externa. There is no smooth muscle. Capillaries don't have any smooth muscle. So the only thing is a single layer of flat cells. So only the endothelium, that's it. And maybe some connective tissue covering it. So just the endothelium, that is a capillary. Okay? And even in the endothelium, there will be lots of tiny microscopic pores or openings to allow for exchange of substances between the tissue and the blood. So lots of microscopic openings. Okay? Lots of tiny little openings will be there. Now capillaries, because of their function, they are called exchange vessels. They are called exchange vessels. So elastic arteries, because they are able to expand and recoil. Muscular arteries, because they have a very thick, smooth muscle, no elastic fibers. Arterioles, mainly smooth muscle, no elastic fibers at all. They are called resistance vessels. Capillaries are the tiniest blood vessels which are going to exchange nutrients and gases. So they are called the exchange vessels. So at this point, the arterial side ends. Okay, this completes the oxygenated blood side. So once the capillaries supply the oxygen to the tissues, now after this, it is the return of blood back to the heart. Okay, return of blood back to the heart, pretty much the same kind of category you will see. So the capillaries will continue as venules. Okay, so this is number 5. They will continue as venules, the tiny ones. Okay, let's see. Okay, So you have, so the capillaries, once they have given off the oxygen and nutrients, the carbon dioxide and the waste products from the tissues will enter into these tiny vessels, which are called venules, because they are now going to go back towards the heart. Okay, so you can see from the aorta, the arterial side, there is a lot of divergence, lots of blood vessels branching off. And from here, when it goes backwards, there's convergence. Okay, blood, lots of venules. So there'll be millions of capillaries, millions of venules. They are going to join together to form the next one, number 6, which is equal to the arterioles on this side, small veins. Okay, and then the small veins are going to further converge, and equivalent to the muscular arteries will be the medium-sized veins. They don't have specific names though. Medium-sized veins, okay? And then finally, number 8, the large veins, okay, which are from the top, superior vena cava, and from the lower portions of your body, inferior vena cava. And then the blood then drains into the right atrium. So it starts from the left ventricle here. We are talking about the oxygenated blood. It starts from the left ventricle, aorta, muscular arteries, arterioles, capillaries, venules, small veins, medium-sized veins, and large veins are equivalent to this elastic artery. So blood returns back to the right side of the heart. Okay, so this is the pathway and how the vessels are placed or their characteristics. Now, you know that the left ventricle contracts and pumps the blood into the aorta at a very high pressure. We have talked about that. The blood pressure is 120 over 80 millimeters of mercury. This is the pressure with which the left ventricle pumps the blood into the aorta. Now, as blood flows from the aorta through the muscular arteries, arterioles to the capillaries, what is happening to the pressure and the speed with which the blood is flowing? It drops, yes. So this is important to understand. So as it flows, so when the left ventricle pumps the blood into the aorta and the major branches, blood flow is very fast. The pressure is also very high. Okay, blood flows very fast. And then as it comes to the arterioles, as it comes close to the arterioles, the pressure drops. Okay, the pressure drops and blood starts flowing slowly. And by the time it reaches the capillaries, blood is flowing very, very slowly, giving time for the exchange. So exchange is not happening anywhere else. It's only happening at the capillary level. So in the elastic arteries, in the muscular arteries, in the elastic and muscular arteries, pressure is high. Pressure of blood is high. And the rate of blood flow is fast. Blood flow is very fast. Okay, it flows very fast. As you get to the arterioles, pressure drops. This is where maximum pressure drop occurs. Pressure drops here. Okay. And then when you get to the capillaries, the pressure is the least. Pressure is the least, and blood flow is also slow. Really slow. Okay, the speed with which the blood is flowing is very, very slow. That's what this is showing you, the speed with which blood flows. So artery, and then arterioles, and then capillaries really slow. And venules also, it is the same thing. Venules also slow. Small veins, slow. But as it comes to the medium-sized veins and the large veins, the speed picks up. It picks up speed, okay? But what about the pressure? Pressure in the veins is always low. It's very low, okay? In the venous side, on this side, pressure of the blood is very low. I'll give you some values so that, not that you have to memorize the values, but for you to see what happens to the pressure with which the blood is flowing. Now you know that your left ventricle pumps the blood into the aorta. Systolic is 120, diastolic blood pressure is 80. Okay? If you take an average of this, 120 plus 80 divided by 2, it works out to 100 millimeters of mercury. This is the average blood pressure. Average, instead of two values, if you take an average, it is 100. So in the actual sense, it's never exactly 100. It is anywhere between 93 and 100 millimeters of mercury. That is the average blood pressure. Okay, average blood pressure, or what we call as mean is the average, you know that, right? Mean arterial blood pressure. Okay, and it is sometimes abbreviated to MAP, mean arterial pressure. So in the aorta and its branches, the pressure is, let's keep it as 100 millimeters of mercury. In the muscular arteries, that is the branches of the aorta, it will still be high, okay? It will still be around, let's say, 80 millimeters of mercury, the average. When it comes to the arterioles, the pressure drops. The pressure becomes 60 millimeters of mercury. Okay, it drops to about 60. By the time it reaches the capillaries, the pressure drops even further to about 35 millimeters of mercury. Okay, very low pressure. And then in the venule side, it drops even further from 35 here. By the time the blood flows through the capillaries and reaches the venules, the pressure is going to be 15 millimeters of mercury. Even low pressure. By the time it gets to the medium-sized veins, 10 millimeters of mercury. By the time it reaches the superior vena cava and the inferior vena cava, 5 millimeters of mercury. By the time it reaches the right atrium, 0 millimeters mercury. So you know that liquid will flow from a region of high pressure to a region of low pressure. Now you understand why blood flows from the left side of the heart back to the right side of the heart, because of the pressure difference. Okay? So when the left ventricle contracts and pumps the blood into the aorta, it's a very high pressure. But as blood moves further away from the heart, the pressure starts to steadily decrease. The maximum drop is seen here. This is where it drops. From 60, it will go to almost 30 or 35. And then in the veins, it is very, very low. Now, this is clearly seen when during surgery, if the surgeon accidentally nicks a vein, or even if you accidentally nick the vein in your forearm or wrist, blood will ooze out slowly, slow oozing of blood. Okay, it's not going to squirt out like that. It will slowly come out. Why? Because the pressure is very low in the veins. But the moment a surgeon cuts an artery, okay, any branch of the aorta, by mistake, blood will shoot up to the ceiling of the surgical theatre. So you know you have cut an artery, and you have to be very quick at tying it up. Okay, because artery, the blood is flowing at a high pressure. So the moment you cut it, it's going to spurt out. Okay, while in a vein, that's not the case. The pressure of the blood is very slow, very low. So even if you cut it, blood will slowly ooze out. It's not going to, it will take some time for a significant loss of blood when you cut the vein. Okay, yes. Like that. So in the aorta, the pressure will be very high, 100 millimeters of mercury. Okay, so the pressure will be quite high. And then in the muscular arteries, it will still be around 80 or 90, like that. And then once you get to the arterioles, you will see there is a drop like that to about 60. And then from the capillaries, it will drop to about 30. And then in the venules, it's going to be like that. So pretty much the same thing in pressure. Okay, this is a rate of blood flow, the speed with which blood flows, but pressure will also be the same. Let me see. Yeah, so you can see this. So see in the large arteries, elastic arteries and muscular arteries, 120/80 is your systolic and diastolic, 93 is your average. So it will be exactly that. But the moment you get to the arterioles, a steep drop, because the arterioles are the resistance vessels. They are going to make it difficult for the blood to flow easily. So it drops. And then capillaries and veins, it drops. Okay? Yes. Have a thinner wall. So they don't have too much of smooth muscle. The tunica interna is also very thin, and tunica media. Okay, the tunica externa is thick. They have more connective tissue. But because of the fact that they have less elastic tissue and less smooth muscle, veins have a thinner wall and they have a capacity to expand when blood enters. So they can actually expand. Okay, and because of the fact that, blood has to go back towards the heart and not in the opposite direction, veins have valves. So these valves only allow blood to flow upwards towards the heart, especially the veins of your legs and your abdominal region. They all have valves. The veins on the upper part of your body, gravity is going to make the blood come down. So the valves are not that essential. The valves are essential for the veins of your lower limbs and your abdominal veins. So inferior vena cava, femoral vein, all of them will have valves which ensure that blood is pushed upwards. Okay? Now what helps with this venous return? This is what we talked about as venous return. So what is it that helps with venous return? Movement, exactly. We talked about prolonged standing and how blood can settle in the veins. There are two things that help with pulling the blood from your lower parts of the body back to the right atrium. There are two things that help. The first and foremost is what is called the skeletal muscle pump. Okay? This allows for the blood from your lower limbs to go back to the right atrium. The veins, the deep veins of the limbs, lower limbs, are between the muscle bundles. So your gastrocnemius, your soleus, the veins are not, of course you have superficial veins, but some of the medium-sized veins are between the muscle bundles. Okay? So every time your skeletal muscle contracts, this vein is squeezed. And when it is squeezed, the valve above will open, the valve below will close. So blood is pushed upwards. Okay? So movement of your lower limbs will help with venous return. Okay? Because all the veins are between the muscle bundles. So we call this is like another term that they use is peripheral heart. So this is like your heart, but it is in your legs. By moving, contracting the muscles, you are able to pump the blood. Okay, push the blood up. This is one skeletal muscle pump. The second one is in your chest. The very act of breathing in and breathing out. When you take a deep breath, your chest expands. And when the chest expands, it acts like a vacuum and it sucks the blood up towards the right atrium. So this is called the respiratory pump. So you have a skeletal muscle pump which is going to push the blood from below, and from above, the very act of breathing in. When you take a breath in, your chest expands, so the pressure inside your thoracic cavity decreases. It is like a vacuum, and it pulls the blood. It sucks the blood up towards the heart. So these are two things which are important for venous return: skeletal muscle pump and respiratory pump. Okay? So when we do respiratory system next, you will see what happens when the chest expands, what happens when we expire. We will see that, and you will see that when the chest expands, the pressure inside your thoracic cavity will drop. So it's like a vacuum pump sucking the blood up. So these are two normal phenomena that help with the venous return. And of course, the valves are important because they will not allow the blood to go backwards. It will only allow the blood to go towards the heart. Okay? Now, if the valves, let's say these valves are non-functional, they become weak, okay? What is it that can happen? If these valves don't work, blood will tend to pool in the leg veins. Okay, and it can cause a condition which is, majority of the time it is more cosmetic than anything, but sometimes can be pretty, it can cause symptoms as well. Okay, yes. Have you heard of this?
Varicose veins.
Varicose veins, yes. Have you heard of this? So these are tortuous blood vessels. You can actually see the veins on the surface of the skin. Okay. Initially, it is just a cosmetic issue. It doesn't look good when the veins are seen, but the complications are it can cause severe pain. Okay. There could be severe pain in some individuals because of blood pooling, and it can also cause clot formation. Whenever blood pools in the veins and it is not flowing, you can have clot formation. So thrombosis can occur without any damage to the blood vessel. Clots can form, and this can become an issue. So varicose veins can occur in any part of the body. Most often we see it in the legs, but it can happen anywhere. Okay? So you can have most often it could be due to occupational thing, people who are standing all the time. Usually in older age, pregnancy, towards the end of pregnancy, you might see some dilated veins. Obese individuals, you can see varicose veins. And varicose veins can also happen in many places. Legs is what you know of, but it can also happen in the genital region, especially around the anus, in people who have chronic constipation, who have difficulty in passing feces. The veins in the anal region can dilate, okay? And that is normally called hemorrhoids or piles, okay? So that is also possible. And you can, anywhere where there are veins and if there is increased pressure, you can have dilated veins, okay? Now, veins, what are they called? The name. Veins are generally referred to as capacitance vessels. Capacitance means the ability to store blood, okay? The ability to store blood. Simply because veins can expand easily, they store blood, okay? So let's say when you're resting, you're not active, your or during sleep, your organs don't need the same amount of blood supply and nutrients and oxygen like during the active state. So under resting conditions, most of the blood, okay, you don't want to work the heart too much at that time. So almost 60 to 70% of your blood volume is stored within the veins. Veins of your abdominal cavity and in the veins of your legs, okay? Especially abdominal cavity, the blood vessel veins of your intestinal veins, splenic veins, that's where the blood is stored. The moment you start activity, the moment you get up and start your daily activity, this blood gets pumped from the veins through your skeletal muscle pump and your respiratory pump. It comes into the general circulation because your tissues need more oxygen, okay? So during rest, almost 70% of your blood volume is stored in the veins, okay?
Is this also part of why you tend to have more?
Capillary exchange, okay? So how exchange occurs across the capillary. So this one, again, there is a lot of understanding here. So maybe I don't want to start it now. So let's do this. Okay. I have some questions for you, so let's do that. So there are about 12 questions based on cardiac cycle and cardiac output. Give it a shot, okay? Just pass it around.